So the first one is surface management. So you've got surfaces that can become contaminated. You've got the floor, which is low priority. You've got the walls, which are low priority. The ceiling, which is low priority. And you've got where the patient physically sits, the dental chair itself. It never ceases to amaze me. I watch people clean up after a procedure and they go for the chair upholstery as the first thing. I'm going, why are you doing that? Like, what bacteria has legs that leap up in the air and can infect patients off the seat? Oh, I don't know. There aren't any. You know, why are you alcohol rubbing the DA seat and my seat? What's with that? You know, like, what's on my butt that you're worried about? Like, that is not important. You should be focusing on these light handles where the suction cradles sit, you know, the bracket table. Like, get the priorities right. So think about the surfaces that actually are important, because the ones that are not don't require anything near as stringent decontamination. In fact, they just become just general housekeeping surfaces, you see. So you can break them up essentially into housekeeping and clinical contact surfaces, and these get broken up into either hard or soft. The logic behind that is you may need a different product for the soft ones. Good example, if you take alcohol hand rub and you put alcohol hand rub all over a bench top, or you take an alcohol wipe and you alcohol wipe a bench top, it's not going to hurt the bench top too much, but you do that to your chair upholstery, you'll stuff it. Because the alcohol will eventually remove all the plasticizers and your upholstery has little tiny vertical cracks in it. You go, oh my God, the upholstery on the chair is kushnookered. So you may need a different product which cleans the upholstery but also restores the plasticizing agents to keep it nice and pliable. Whereas your hard surface, like your bench top, could be something that could be different. So remember, the chemistry for upholstery may need to be different. And the upholstery is low priority. Well, upholstery, things don't leap up and jump up in the air. So, you know, this is high priority, this is low priority. Okay? Housekeeping is basically where there's a limited risk of transmission. So let's look at the clinical contact ones. So we're going to touch the light handle. We're going to have things that sit on the bracket table. We might have a working surface where we mix up and touch clinical materials. We've got the door handle where the patient might touch and we might touch. Now that can now just because, you know, people touch it coming and going, but that's not within the splatter zone necessarily. And we've got the area where the patient lies down, but that's of much less importance. This is a soft surface which is a low priority surface. Whereas these couple here, these are high priority surfaces, aren't they? Look further around the room, yeah, the ceiling is like, well, you know, it's just the ceiling. You know, the area around this bench is miles from the action, and this floor over here is miles from the action as well. So these don't need to be, you know, brutally cleaned, except for regular housekeeping purposes, which you might do, for example, typically, you know, once a week, you know, you might be whizzing over, you know, the floor maybe more often, but, you know, because you'll just get dust on things that will build up. So it's actually thinking about what is the priority of these different surfaces. Not just saying, well, the chair upholstery is the biggest one, so let's do that one first. It's like, that's not important on the grand scale of things. So let's work our way through this. So first thing is, we're going to put on some gloves because we're going to be using some detergent here. The detergent helps to lift the organisms up off the surface. And that means you've got to wipe the surface in an intelligent way. If you imagine the surface was covered with flour or Johnson's baby powder or talcum, and you went like that, you would spread the talc everywhere, wouldn't you? So if you want the detergent to do its job best, you should go around and try to collect it all into the middle and then pick that last bit up. That's your first time around. Your second time around is to dry the surface, and that's where you can use that sort of action. But the first time around, it's like picking up powder. You've sort of got to corral it a little bit. It's a slightly different action. So correct wiping technique is actually quite important. Don't splash things like glutaraldehyde or hypochlorite around. They damage surfaces, and it's simply not necessary. They introduce risk. There's some really neat things around, either as wipes or liquids. These ones over here are based on weak peroxide. They seem to be really, really good. And there's a whole range of different things which are around. What you need to realise is the key thing is you've got to have some detergent and you've got to have the right technique. If you want to have things that got funky flavours and nice smells, go crazy. I don't really mind. But the technique is absolutely key. Absolutely key to it. So do the services that are most important first. Which services got the greatest risk of transmitting infections? Do those ones first. Housekeeping services, less important. Do those ones last and less often. And then think about the areas that you've got to wipe. So on this chair, there's barriers on both sides. Yeah, you can pull those barriers off, but maybe this chair was designed to have those handles just wiped over. Wouldn't that be quicker and easier? You know, I've seen people pick up a handpiece to use and they're slipping around like a wet fish trying to hold the handpiece because it's in a bag. I'm going, why is the handpiece in a bag? Oh, I don't know. A handpiece is designed to be sterilised, that's right. So why is it in a bag? I don't know. Maybe it shouldn't be in a bag. So just rethink whether you're creating more troubles than you actually deserve. Light handles is a classic one. Yeah? Most light handles are designed to be wiped. If you want to get really pedantic, you only need one light handle, you don't need two. How often do you need two hands? Is your light that stiff you need to get two hands on it to bend it? I don't think so. You know, chances are you only need one. If your light handles are removable, here's something clever. Take one off. And that looks a bit wonky, but then you only got one to wipe. Saves half the time. You know, crazy idea. We did that in one of our clinics. It worked really well. People soon learned, oh yeah, we use the one on the left-hand side because that's the one that the operator adjusts. Yeah. If you're in the habit of having your assistant adjust your light quite a bit, go crazy. Keep both. But if they're removable, maybe you don't need to. You know, just think about it. Give it a little bit of a thought. This is a practice I worked at in a state south of here that Shari may notice, but it starts with V. And they had this bag over the headrest. And I said, what's with the bag? He said, well, we're not really sure. I said, it's because you think I've got nits or you're worried about hair loss or what's the story? Oh, we're not really sure. I said, do you know what that sounds like to a patient? You get crinkle every time you move your head. You know what that, as a patient, that feels like? That you put a bag here to protect our chair from you, the patient, because we think you're really scaly? It's like, I hadn't thought about that. It's like, yeah, like, what's with that? I don't know. I said, I've got the same chair as that. We wouldn't put the bag there because, you know, the splatter goes that way. It doesn't go around the outside and come back. It only goes in one direction. So it's like, oh yeah, okay. They love plastic. I mean, look at this. I picked up this and I said, oh, come on. Look what you're doing to me. You know, it's like, anyway. I said, look, this thing over here, I said, this is designed to be wiped. Guess what? It's the same here. You wipe that stuff over. Like, what's with the plastic? Oh, I don't know. That's right. Absolutely. This is another practice I worked at. Had the X-ray in a bag. I said, what's in the bag? He said, oh, we don't know. Because, well, you pick it up and you've got your gloved hands and you get like your gloved hands all over the bag and it's a bit awkward sort of position the bag and you shove it against the patient goes, the bag's over the face. I said, you know what? You take your gloves off, 10 seconds, you know, alcohol spray, you pick up the X-ray, clean hands, you park it where you want it to be, your hands are clean so you can go to the button and go, doesn't go, hit the go button, pop on your gloves, keep on working. Like, oh yeah, how long does it take to put this thing in a bag? I don't know, about 2 minutes. I said, guess what? You save on the bag, you just save two minutes, the patient will thank you, and if you touch the patient's skin with the end of the tube, just wipe that with an alcohol wipe. Oh yeah. It's like, that was an easy one. This practice I helped design and build. We got a bit carried away and we decided to make all the benches out of glass. Like, oh, how cool was that? Then we lit them from underneath, like, oh, it was really, really, really cool. Terribly expensive way of doing practice, but, you know, there's the X-ray. Notice, no bag. You know, it just saves effort and time, gives you a better result. So sometimes people just get a bit carried away with bagging stuff. Yeah? This was one of my favourites. They put their curing light in a bag. I'm saying, there's a 200-watt lamp in there. Like, that's ventilation slot. You cut it over, you get a fire. Like, okay, yeah, okay, fair enough. So don't introduce a new risk by bagging something that doesn't need it. You know? Just try to keep a rational head. And maybe you save yourself some time and effort. Yeah? Look at all the new chairs we've built, you know, new practices with 6 or 7 different brands of chair in the last couple of years. All over South East You won't see much in the way of bag. Because it's all services designed to be wiped. It's all smooth, clean tubing. That's why it's made that way. So don't bag what you have to bag. Just a couple of shots. This is Griffith University. This is a couple of shots of a couple of chairs we had at UQ when we were setting up all our prototypes for the new building. Again, it's all designed to be white. All white, all white. So you go to the ADA guidelines, again, source of all wisdom. You've got barriers, yeah, but barriers are the things that are tricky to clean. If it's not necessary to use a barrier, then don't. You've got a barrier, that surface at the end of the day is going to be barrier free. You clean it, and you should be asking yourself, that's interesting, if we can clean at the end of the day, why can't we clean it during the day? Oh, I don't know. So go back and rethink where you need barriers, because you may not need as many barriers as you've got. So here's a guide. Go back to NHMRC. Use barriers in places that are hard to clean and get contaminated and you touch all the time. And. Well, if it's easy to clean and you can clean it by wiping it, well then you do that. So sometimes people have got a bit carried away. And that's not necessarily always a bad thing, but I'm just putting the science back onto barriers for you.
So Laurie, we actually use a brand for our Caring Mind as well. Do you do that for your intraoral cameras in your practice?
We have sleeve, that's right. Yeah, it's like a little condom. You sleeve your slide over here. Yeah. And all the cameras have got pre-made sleeves that fit and they stretch so they don't mess up the optics of the lens. Because most cameras are not designed to be white. They haven't been built, because it's really hard to do optics that are fluid proof. So most things have a custom sleeve. Yeah, absolutely. So that's what would be one of the few things you'd still have a sleeve on. That's right. Yep. So housekeeping services, that's just basically cleaning the surfaces that are non-clinical services. Remember how things grow in water? So fresh cleaning solutions made up. That's just detergent. Nothing too hard about that. Nothing too tricky at all. So if you've got welded vinyl floor, which is quite common, people have that. If you damp mop that comes up pretty good. Nothing too tricky there. What we've done additionally in the last couple of years, which I mentioned before, is we have a once in a week wipe over door handles. All the things we think patients could be putting their hands all over in the waiting room. So it's a little weird waiting room. You can see there's the hand gel dispenser, there's the tissues. So these sort of random door handles around there, we'd be wiping those just with an impregnated wipe, just to recognise that patients may be throwing a bit of their materials around the place. It just makes it a lot easier. In new facility, the doors are all automated, so the patient doesn't even need to touch them. So we've got eliminated door handles as much as we possibly can. But again, it's just a few little tweaks that you might find useful to have a think about. If you look at the NHMRC guidelines on environmental cleaning, you can see all the low-risk surfaces. You basically, around the chair, the upholstery, that's just daily cleaning. The doorknob and door handles, that's weekly. The floor is damp mopping, probably twice a week. The sink, around the sink is normally cleaned every day. And the services that are further away are normally, this is basically hospital-based, that's a weekly clean there too. So, they're the current guidelines. They're good to follow. Just guidelines. But remember the upholstery. Don't stick alcohol wipes over upholstery because you're likely to stuff it up. It may not happen quickly, but if you notice on the alcohol wipe you're getting colour coming off, not good. The upholstery colour is coming out on your wipe. You should worry that what else is coming out as well. So alcohols can certainly cause degradation of upholstery over time. If you have something that's heavily fragranced, some fragrances also attack components of dental chairs. One particular sort of fragrance is notorious for attacking plastic polymer. And that is one of the fragrances from tea tree oil. So if you have something that's heavily flavoured with tea tree oil and you use that on plastic, you'll find that plastic will start to go a bit yellow over time. That's no accident. Then you're actually breaking up the polymer structure of the plastic because of the action of that particular phenolic agent. So we're currently doing a bit of research to produce a reference table on surfaces and products, like a ready reckoner, what goes with what. But ask your chair supplier what products they know are safe on your branded chair. And they'll have some specific recommendations for you, I'm sure. And they probably know which ones they know are trouble. So don't just assume that any old white is fine on the upholstery. The upholstery will often need something different. And again, you probably don't need to go crazy about wiping down your assistant stool or your operating stool, because really, you know, are you wiping down your chair at home before you sit down at night? Probably not. Probably not. Then there are essentially there are what I call the no-touch surfaces with gloves. They only get touched with clean, bare hands. So in this example here, you can see we've got gloved hands all over this X-ray tube. That means you've got to wipe down this X-ray tube. Well, it'd be much more sense for me to have the gloves off and use bare hands to position the X-ray, and then to alcohol wipe the area that touches the patient's skin right at the end. That just means I haven't got to decontaminate this entire X-ray head. That just saves time and effort. Sorry?
What if you're taking more than one film and you're moving it from place to place to place, and you've got to remove your position device? Are you going to be degloving after you've done it each time?
You might. There's a few ways you can do that. Oops, just a little beep over here. If you're doing a multiple set, like let's say you're doing, say, full mouth PAs or something like that, in that scenario you might say, well, actually I'm going to be here for 5-minute shoots of full mouth PAs. That actually makes sense to me to keep my gloves on. At the end of that, I'm then going to wipe the areas where I've touched, and I know because I put a bit of tape on here, this is the zone I clean, but I don't need to wipe this or this or this or this or whatever. So as long as you designate those, you can have, if you like, a second protocol, but you've actually marked it off with, we found electrical tape looks a bit unprofessional, so what looks really nice is professional vehicle bling tape. You know, if you're putting GT stripes or something on a car, you get these really nice, high definition, really thin tapes that you can put around a piece of gear on a bench top, and they look like a bit of a design thing. They don't look like a big piece of electrical tape that comes in only so many colours. And they can define an area, and that helps you when you clean up to limit where you touch and limit therefore where you have to clean. So you can definitely do that. Nick, no, that's an excellent question. So I'll just run through this and then we'll have a break for afternoon tea. So obviously X-rays, charts, computer keyboards, CAD-CAM, tablets, X-ray controls, telephones, radiographs, and hence the question about the X-ray tube. You can handle that gloved or ungloved as you see fit. But because you can get your gloves off and alcohol hand gel your hands really quick, there's no reason to put gloves on all these gadgets. You can just do that with your ungloved hands. It makes life so much easier to work with. Okay. All right, so that then brings us up to supplies, which is after afternoon tea. Good. Okay. Good. Thank you, Sheridan. All right. So I thought I'd just show you a couple of images of areas where handling the supplies has been done in a slightly unusual way. Here, you can see we've got a big long side bench. We've got a couple of things. These are just containers from Officeworks, which is quite a good way of keeping your supplies sort of visible and viewable, but out of the way of splash. What was unusual in this particular practice I inspected for the board was they had lots of things on display. So who keeps their collection of paper cups we're about to use or bibs for the next 2 weeks on the bench? I just couldn't quite see the logic of that. And you can see in this room here, of course, they had like 400 cups on display, so I don't know what the logic was there. So this stuff should be, of course, away from environmental contamination, so should be living in the drawer. You can see here they've got supplies sitting in the middle of obviously what's a working zone. So here's the transfer tweezers, here's an old amalgamator, box of tissues. We've got some supplies besides the most, and the shelves now. Like, how does that make sense as a sequence? It's just things all sort of mixed up together. So again, too many supplies on the outer. Transfer tweezers, I'm sure you know about how you can open drawers and remove things. But of course, now, you can take your gloves off, 10 seconds, fish around in a drawer, close the drawer, and keep on going. So alcohol hand rub could make it more efficient to actually drop your gloves off and go looking. And when I'm doing a restorative procedure, when we get to the point where I'm going to choose my material, my DA will take her gloves off, hand gel, and then I'll say I want some of this composite and some of that bond and whatever, and she can then handle all those things and then dispense those to me with clean hands, so she's not putting gloved hands over any of the stuff in the drawer. So we found that quite an efficient way of working. Waste bags is pretty self-explanatory, so I might just skip over that.